Hello guys, welcome back to the channel. It's Unit 7 Part B. Now the very important topic in this chapter, that is abortion. Abortion, you might be heard, but do know the definition. That is nothing but the premature expulsion of the conception. That is, before the baby grows fully, in the premature stage itself, in the conception stage, that is during the pregnancy, the before growing properly, the baby will be expelled from the uterus. That is abortion. And this abortion has various types. Now we are going to see that. This is very important. And one thing, abortion can be seen within 28 weeks of the pregnancy. When the conception starts, this abortion occurs within 28 weeks. Okay. So abortion can be two types. One is spontaneous and one is induced. Spontaneous is the natural way. Induced is the man-made way. Like we are willing to get abortion. So I'm undergoing. That is induced. Spontaneous is occurring naturally. This induced have legal and illegal. The very important thing is spontaneous. In spontaneous, you can see there is two types: isolated and recurrent. Isolated is, this is the first time this type of abortion is occurring in the patient. Recurrent is, this is the second or third time the same type of abortion is occurring in the patient. Like previously I was got pregnant and I have got abortion the same type. Again I'm pregnant, I'm getting the same type of abortion. That is recurrent. Okay. This isolated and recurrent has 6 types, and the first 4 types has very importance. These last 2 types are etiology of abortion. One is fetal factor, other is maternal factor. In fetal factor, if you see, there are two causes. One is abnormal growth and chromosomal defect. If the baby is not growing well, then automatically it leads to abortion. If there is any defect, then still it leads to abortion. The main cause is maternal cause. Here, this is very important. Generally, the abortion is due to infection. To make sure there is no any infection, we will do a test called torch test. This is the torch test, and the torch test full form is Toxoplasma gondii cytomegalovirus herpes virus rubella virus. This is the full form of this torch test. This is performed to make sure there is no any kind of infection present in the mother. And the other reason is endocrine disorder. If the mother is having any kind of endocrine disorders, a hormonal disorder like thyroid or any kind of cystic ovarian cystics like that, it will lead to abortion automatically. If there is any drug use in the sense, if mother is addicted to alcohol, tobacco or any other unhealthy lifestyle, then definitely the baby will not grow healthy. It will lead to abortion. Next, medication. Any unprescribed medications or any overdose of medications will lead to abortions. And autoimmune disorders, mainly AIDS. If in many cases, even at the time of AIDS, the baby is born, but in probably in many cases there is no growth of baby, leading to abortion. The first is threatened abortion. In a simple word, abortion has started, but still there is a possible that if we take care of the baby, the abortion will get stopped. It doesn't lead to abortion. This kind of abortion is known as threatened abortion. In general, in this condition, the abortion occurs due to the delay of the care. They will not know the seriousness of this. They think it's just normal bleeding and they just leave it, and that leads to abortion. That is how this threatened abortion occurs. Here the main symptom is pain. This pain is generally in the pelvic and the abdomen region, heavy pain, and bleeding that leads to dehydration, hypotension, fatigue, decrease in glucose level, dry tongue, sunken eyes, and many more. The main symptoms is bleeding and the pain. This too is constant in whole abortion process. And what are the investigation? Since there is heavy bleeding, we will do check HB estimation, blood group, to make sure if there is very lot of blood is lost, then we need to provide them blood. So we will make sure blood group is detected, urine analysis, and ultrasound to make sure everything is removed in the process of abortion. Next, Treatment is given mild sedative and tocolytic drug is provided, IV fluid to make sure there is no dehydration and further thing. The main medication or the treatment that provided here is bed rest. This is the main one. We will advise the patient to take bed rest till the bleeding stops. It's generally recommended for a week to 10 days. Within that, the bleeding stops. And good diet helps to regain the loss. This is threatened abortion. Inevitable abortion. In this, the abortion process started, but there is no chance of recovery. That is inevitable abortion. In this abortion, you can see there will be lots of vaginal bleeding. Generally, everything, this bleeding and pain is common. Okay, this bleeding and pain is common. You can see here the dilation, that is the fetal itself will try to come out. Fetal in the sense the fetus is not grown properly, but the product inside the womb will make a progress to come out. That is, there will be a dilation can be seen here. What are the investigation? Generally in whole abortion process, the investigation is very simple. We have to find the HB count, blood group, pain level will be assisted to provide painkillers, urine analysis will be assisted, ultrasound will be done. I didn't mention here, but generally you can have it. Next, treatment. We have IV fluid, blood transfusion, and this one is extra here. That is oxytocin drip of 10 unit in 5% of dextrose. This is because there is fetus is trying to come out. So when we provide this will make the process easier. The fetus itself will come out. For the ejection purpose, we provide this medication, and for this the main nursing care that we need to provide is psychological support and explain the process, what's going on, and provide the treatment. This itself not, you can add more than 15 points to this process. Next, we have incomplete abortion, in the sense the product inside the uterus is not came outside fully. There is something left behind inside the uterus, that is incomplete. The abortion is performed, but not fully the product is removed. And here if you see, there will be excessive, the bleeding is the only reason that leads to this incomplete. Because of excessive bleeding, we can't see whether the full product is came or not. We will not be able to remove the product. HB count definitely will be counted here, and even you can see the pain level. As usual, ultrasound, everything will be performed. Ultrasound is performed to make sure whether the full product is removed or not. Okay, here in this condition there is an extra treatment that is provided for hypovolemia. Because of this excessive blood loss, hypovolemia is a common one. This might occur. We need to provide treatment for this. Related medications prescribed by doctor should be provided. Sedatives to reduce the pain, and IV fluids to maintain the level of energy. And comparatively, in all the abortion process, this abortion process requires more time, longer time. So care is also should be provided based on that. Mainly pain is the main source here, so we need to provide the care for the pain. Complete abortion. Complete abortion in the sense abortion has occurred and we have removed everything. Very simple process. In this process, the uterus opening also will be very small, bleeding will be very less, so the treatment is not very major. Routine checkup with that ultrasound to make sure there is nothing left out. That's it. IV fluid and painkiller will be provided. Just complete rest is enough. With good diet and good support, this patient will get recovered. This is all about abortion. Abortion is not just based on the process, even based on the site the abortion occurs, or abortion made, man-made. That is, these are the things: ovarian pregnancy, abdominal pregnancy, tubal pregnancy or ectopic pregnancy. Again, pregnancy in rudimentary uterine horn. That is, see, if a woman is pregnant, the egg should come and get attached in this uterus region. That is the normal pregnancy, and that is how the pregnancy should occur, this will lead to the good growth. But when the egg is coming from this ovary, this is ovary, okay, from this ovary, if this egg is traveling, sometimes in some cases the ovary will get attached here itself and start to grow here. This is ovarian pregnancy. Or sometimes it goes this way, this in this tube, fallopian tube, in that region, this fallopian tube, in this region the egg starts to sit here and get deposit there and starts to grow there itself. Can a fallopian tube get expanded as the uterus can expand? That's not possible. So this is a false pregnancy. That is, tubal pregnancy is ectopic pregnancy. At these conditions also, we legally perform the abortion process. And abdominal pregnancies and other regions, based on the site also the abortion is performed. Apart from this uterus site, if the egg goes and deposits somewhere like in the fallopian tube or near the ovary, then we legally perform the abortion.
Questions will be provided at the end of the chapter. Until then, stay tuned. Bye.